Wayanad is located at a distance of 52 kilometers from Calicut and lies at a height of 702,000 meters above sea level. Wayanad, with its scenic beauty and wildlife, become prominent in the tourist map of Kerala. The backward district is one of the biggest foreign exchange earners of the state, being the land of cash crops of pepper, cardamom, coffee, tea and other spices. It is a homeland of various tribal communities. The British rule made a new turn in the history of Wayanad. The British authorities opened up this land for cultivation of tea and other cash crops. The large-scale migration started from South Kerala in 1928 and it had got acceleration after the Second World War. Many migrants settled in different parts of Wayanad. One important characteristic feature of this district is a large Adivasi population. Wayanad district came into being in the 1st November 1980. Even before and after the erection as a district, Wayanad is a backward district of Kerala, especially in the case of healthcare and transportation. In order to have a treatment and survival, people had to depend on Calicut in those days. We cannot climb much better condition even today. So it was more 43 years ago. Many people lost their lives due to Kaisanur forest disease and other vital diseases. There was no agencies to look into the health care of needy, especially the tribal people in Wayanad. In that situation, inspired by the words of Saint Elias Kuriakose Chavara, the founder of CMI congregation, let there be no day in your life in which you did no good to others. The then Vice Provincial of St. Thomas Province, Reverend Father James Pallivathukal, decided to start a hospital at Kalpetta. In 1972, there was a small hospital named Bosco Hospital, run by Dr. Vijay Sebastian and Dr. Teresa Sebastian. Since they had planned to go for their higher studies in abroad, that rented hospital building was purchased by the province and was renamed as Fatima Mata Mission Hospital. In 1973, a new plot of 5 acres was purchased and a hospital was constructed. Slowly, Fatima Mata Hospital grew up, specialty hospital of Wayanad, with a clear vision. Since 1973, Fatima Mata Hospital has been playing a pivotal role in the healthcare of the district.
Inspired by the words of our founding father, Saint Kuriakose Chavara, let there be no day in your life in which you did no good to others. We try our level best to provide service to our patients as per our motto, healing with love.
The hospital is managed by the St. Thomas Province in Calicut under the CMI congregation. The team headed by the provincial has board of trustees with director and administrator. In 1979 came the changing phase of the hospital by inculcating the departments like pediatrics, ENT, orthopedics, dermatology, emergency, intensive care unit, X-ray, medical laboratory and pharmacy. The bed number increased to 200.
As a mission hospital, we always keep our promises on healthcare with the best professionals and constantly improve the health of community we serve. Moreover, we update our hospital facilities in order to be the destination of wellness of any individuals who need our services. Our healthcare mission orientates us to be the better medical facilities in Wayanad district. That is why our hospital plays a vital role in Medicare even today.
Fatima was the only health center in the whole of Wayanad region for the patients to depend for surgeries in 1980s. Before any other health center came into existence, there was good flow of patients to the outpatient department. Fatima Mata School of Nursing was the district's first nursing school. The school was initiated under the guidance of Father Thomas Gutiani CMI, along with Father Joseph Mattam CMI, as a wing for the hospital. Students are trained in departments like emergency, operation theatre, labor room, dialysis, intensive care, surgery, medical, and pediatric wards. The school received the recognition of Kerala Nursing Council by November 2nd, 1994, and Indian Nursing Council by March 12, 2001. By 2017, 410 nurses from 20 batches have entered into nursing profession. 2009 initiated the district's first dialysis unit. The dialysis unit was initiated for the Joseph Violil CMI, the then director of Fatima Mata Mission Hospital, under the guidance of nephrologist Dr. Sunil George, on the constant request from the patients who had to travel 3 to 5 hours to Calicut for dialysis. The unit started with 2 machines around the clock. Now the unit has 8 machines working in 3 shifts. The unit covers over 500 to 550 on monthly basis. When the healthcare system was getting advanced, the medical team of Fatima Mata Mission Hospital found that the trauma cases were increasing, and therefore we had to pool a CT scan facility. The then director, Father Joseph Violil CMI, initiated the process to add in this department. Patients in this region had to depend on one center in Wayanad. On an average, about 1,500 cases are attended on a yearly basis. Those patients who need referral on diagnosis are referred to the specialists as per need of the patient's condition.
We try to bring in services that support the patient care according to the advanced technology. We make sure that the patient moves out with a satisfaction.
As patients increased, the limited facilities were not able to accommodate patients in outpatient department. This had to be restructured and built, accumulating all the outpatient services within the reach from the scattered locations. This dream was fulfilled in 2016 by the then director, Father Sunil M. Anthony, CMI. The team of well-trained staff is the driving force for giving quality patient care. The day for the hospital commenced with a session to invoke God's blessings by gathering a quadrangle. Departments are categorized based on their service. 24-hour service includes casualty and wards. To support their coordination, front office, medical records, pharmacy, medical laboratory, radiology, safety and security is on alert 24/7. In case of emergency, operation theatre is also informed and arranged. When speaking about nursing care, it also includes intensive care unit, post-operative care, and labor room which is on service around the clock. We were processing to get organized with all departments after the inauguration of new block. Patients were received with more ambulances and were they easily directed to the places where they had to reach for various services of laboratory, X-ray, pharmacy, dental or any other outpatient department. Emergency. If any emergency cases arrive, they were directly brought to the emergency department without any other hindrance. This department has a facility to receive all trauma cases around the clock with the guidance of emergency coordinator. Reception. The staff in reception is trained to handle the patients, registrations, and guiding to the various hospital services. When any external complaints are received, they are directed to the public relations. Medical records. Once any outpatient registration is entered in the system, the concerned file is created or segregated for the respective treating doctors OP. Pharmacy. Our pharmacy is among the departments that provide 24 hours medicine. There is a good coordination among OP and IP pharmacy. This is a licensed center with registered staff support. Medical laboratory. The medical lab has a facility of processing tests of clinical pathology, serology, immunology, biochemistry, and microbiology. Radiology. We are equipped to receive all trauma cases and analyze treatment through CT scan, X-ray, and ultrasound scanning. Recognized as Eye Collection Center. Our hospital is the first center of donating eye in the district of Wayanad. The medical team is coordinated through the project of HOPE. This recognition was obtained in October 2017.
Our team of medical professionals coordinates to provide best results on treatment.
Medical team. The hospital has a medical team headed by medical director consisting of both regular and visiting consultants. Regular OP includes general surgery, general medicine, gynecology, pediatrics, clinical cardiology, orthopedics, and psychology. Visiting team consists of ENT, nephrology, urology, dermatology, and clinical psychology. Few departments such as dental, homeo, and physiotherapy are outsourced. Community work. The hospital extends healthcare services to the community by organizing medical camps. Most of the camps are on having free medical checkup, blood grouping among the groups who cannot afford financially. The consultants provide health education among the various groups of the population such as students of high school, higher secondary, professionals of Red Cross Society, Rotary Club, Women's Club. Public rallies were organized in relation to World TB Day and World AIDS Day. The working nature of all staff in hospital was standardized with the training under NABH. For smooth functioning, various communities were formed. Staff nurses are trained in code blue with demos and practiced.
Room number 631. Code blue in Chavara third, room number at 631. Code blue in Chavara third, room number at 631. Mr. Babu, are you okay? Are you okay?
Shall we shift over the patient to ICU? Sure, sir.
Every staff is trained in code red. There is a safety team to monitor the functions. Mock drills are conducted for providing better care and caution in hospital premises. The securities are alerted on code grey. Instructions are given to the staff on every gathering in department.
Code red in Chavara third.
Code red in Chavara third. Code red in Chavara third.
future plans. Our short-term plan includes incorporation of departments such as neurology, cardiology, nephrology, urology, gastroenterology, and additional orthopedician and physician. For the patients to have better access to external services, a plan on coffee shop, ATM counter will be arranged. An ambulance with mobile ICU facility will be on move within a year time to bring the EMR for medical records department. To have a facility of EEG IP counseling for patients. Long-term plans include to pool in blood bank, MRI scan, CSSD, cath lab, emergency medicine, OT with laminar flow, expansion of canteen, well-equipped laundry and accreditation of NABH. Our combined effort is to provide healing for every patient through holistic approach.